Good afternoon. Good afternoon. This is Emmett McCord, and you're looking at the From the Top show with Emmett McCord. Today is Saturday, May the 8th and 9th, and so we are here to have another show with you on From the Top to share some information with you that I think will be a blessing to you. I thank God for this opportunity to come before you. I want to encourage any of our viewers that come in to make comments on our comment board or ask questions. We'll be happy to answer them. I have a wonderful guest on, Dr. Kalina Brown from Tennessee. That's where she is right now, and she'll be joining us shortly. But I also want to address those viewers who are looking at this show a year from now, next week from now, or next month. And I want to encourage you to leave your comments as well. This information that we're going to share is timeless, so it will be a benefit to you, and I pray that it is, and I pray that what we do today and what we talk about will be a blessing to you and your family. And what we're talking about today is coronavirus and how it's affecting the mental health challenges in our community. And because we are we are in the hot spots around the world, wherever people who are in the lower income or in the race of Black people or Hispanic people or Asian people just seems to, and everything seems to be falling on us. They're calling us the essential workers, and so consequently we are having to face this corona pandemic head on. And of course, the number of minorities who are being affected by this virus is very high. So we want to talk about also how that's affecting our mental health in our community and those who are challenged in that area in their life, because they were hurting already. And so we want to talk about what's happening with them now, because we know that it's even compounded now with what's going on in the world. I want to share with you also something that I've been keeping the statistics on. I started recording the number of cases and the number of deaths of the coronavirus in the United States on March the 23rd this year, 2020, March the 23rd. It was 40,069 cases, total cases in the United States, just a little over 470 deaths at that time. Now, as of May the 9th, May the 8th, we have 1,244,000 cases and almost 75,000 deaths. That's amazing in just a little over a month and some change there. This virus is taking us out, taking people out. People are dying. We don't know anything, a lot of things about this virus, and even whether it's affecting children or not. We're just not sure. The word is just, we just need to be very careful and try to shelter in as much as possible. So we're going to talk about that, and I want to talk about, first of all, I want to introduce my guest. I want to bring her on. Dr. Kalina Brown. She's a licensed professional counselor here in the state of Georgia. She's the founder and CEO of Realizing What Matters. Realizing What Matters is a behavioral health supportive service company. Dr. Brown has a master's in counseling from Arkansas University and a Bachelor of Science in Psychology from Georgia State University, and an Associate's Art degree in Psychology from Palm Beach Junior College. Recently, over the last 30 years, let me just say, she's been involved with a lot of things. Her roles have included private practice, cognitive. In her private practice, she dealt with cognitive behavior therapy. She supported numerous patients in developing healthier methods for processing their issues in the world. She's a social worker and organizing projects for family reconstruction as it relates to homeless, grief, and family violence, which is something we had talked about on our last show. She was also recently in 2017 and up to 2020, she moved to Ghana, South America, to work with the Ministry of Public Health as the senior psychiatrist of the country. In that role, she was tasked with developing the policies and procedures for the country's mental health system. So she knows what she's talking about, and we're just grateful to have her on the show. And I want to bring her on now. Dr. Brown, how are you? Kalina?
Doing well. How are you? Thank you for having me.
Oh, wonderful. Yes, absolutely. I'm excited about you being here, and thank you for being here. You're all the way up in Tennessee now?
Texas.
Oh, you're in Texas. That's a long way from Tennessee. Okay. Oh, okay. So what part of Texas are you in?
I'm north of Dallas in a small city called Aubrey, Texas. Mm-hmm. If anyone knows Texas, it's around McKinney, Plano, Frisco, in that area.
Okay. All right. Well, fantastic. Well, great. Well, it seems like you've just been really busy. Tell us a little bit more about yourself. I know that what I said was just a capsule of some of the things that you've been involved in, but we met about 5 or 6 years ago on my show From the Top at WIGO Radio, and you were one of my guests, and I was very happy to have you. I'm so happy to have you back as well. So tell us a little bit about what you've been doing.
Well, most recently, living in Guyana, South America for 2.5 years. I got back to the States in November, basically because of my own medical health. So had I not been that, I would still be in Guyana working with the government on their mental health projects. In Guyana, I'm considered a psychologist based on the country's definition of my qualifications. And the main reason for being there was Guyana has the highest suicide rate in the world. Wow. They like to say the third highest, so you'll find statistics that go from being the first or maybe the third highest in the world. And they really need help working on their mental health system. So policies and procedures is what I was working with them, helping them put those in place. And so if you back up from that, I closed my private practice in 2016 in order to move to Guyana and start that work. The mental health field, I like to say since 9th grade, because that's when I was first introduced to psychology and began understanding the value of being able to do the work that helps settle your brain. I like to talk about mental health as a brain disease because a lot of people are adverse to thinking about themselves as being mentally ill. So we also start using the word behavioral health. Okay. Because of the negative stigma behind the term mental illness. I sometimes refer to myself as a behavioral scientist because we work on helping people understand their behaviors, the origins of their behaviors, patterns of their behaviors, and if that tends to be unhealthy, then we want to give them tools and techniques by which that they can better manage the world in a healthier way. So I could easily say that my entire life has been involved in mental health from one aspect to the other. I've done social work, I've worked with the Atlanta Housing Authority, I've worked with the Atlanta Public Schools, I've worked in organizations where I was a counselor, a social worker, I've worked in organizations where I worked worked directly with teachers, kind of public schools, alternative schools. I worked in probably the major hospitals in Atlanta because that was where I spent most of my time in my practice within Atlanta, Georgia. So I've worked with Grady Hospital, I've worked with Peachwood Hospital, I've worked with Riverwood, and probably a couple more I can't remember right now. So absolutely, mental health is why I came to the planet. I think that when we can find our purpose, we also can make sure that we adhere to that. And I am very thankful that my purpose was introduced to me very young, and I believe that with God's help, I've been fulfilling that purpose.
Well, we're just absolutely sure that you're the right person to be on the show to talk about this coronavirus and the mental health of our community. Absolutely. And with all of that experience, we are going to have a great discussion. You know, coronavirus is just it's consumed our society. I'm sure it's like that in South America, or if it's not, it's on the way. But certainly in America, we know that the coronavirus has just changed the lives of everyone practically, especially in the Black and brown communities in the United States. Statistically, when you look at the hot spots in the United States, they're primarily areas that are primarily dominated by brown people, African Americans and Hispanic people in America. And so, you know, we're just we want to make sure that people don't lose hope. And so, you know, I want to talk about something that I actually heard last night from this organization called Healing the Nation. You may have heard of them. They're actually a group that's focused on mental health in the Washington, D.C. area. And they said that this coronavirus is a triple threat against the well-being of the mentally challenged people in America. One being the health system, one being the judicial system, and one being the employment opportunities for mentally challenged people. And they went on to say that it was a structured inequality in America that was already here, but now is being more exposed because of this coronavirus. And what do you think about that? Do you agree?
Absolutely. I agree that in our particular sector of the culture, we are at the high end of most everything that's unhealthy. And sadly enough, the coronavirus has shown itself to be true, whereas we are experiencing the higher numbers of positive cases, and from what the news is reporting, a higher number of fatalities. And when we look at it from that aspect, and it makes sense that it will trickle through the entire spectrum of the society. So yes, when it comes to the health. Now, the thing that I focus on specifically is to help people understand, or I think demystify mental illness, because there's a difference between mentally challenged and mental illness. And the way that I attempt to explain that is when you are mentally challenged, something's been broken, let's use the brain, and beyond repair. So you will maintain that level of mental disability specifically. Mental illness, on the other hand, is like the brain being sick. And with a sickness, there are treatments and there are particular systems that you can put in place. So let's talk about mental illness. That's when the brain is sick.
Okay.
Yes. So when I look at the coronavirus, for me, I look at it in a space in which I want to help people understand that if you take it in its entirety, it will become overwhelming. And I think because we're being inundated by it on the news and everything you read, then that tends to have an unbalanced effect on our brain. What I want to help today, if we can, is to begin a conversation about narrowing your focus and beginning to understand that throughout all that's going on, you still have control. You still have power. And where your power and control is where it's always been. It's when within those things that you have power and control over. And I think when we can focus, we can't change the landscape. We don't control that. What we can control is how we allow the landscape to affect our day-to-day life. And the first thing is to recognize that you do have control over how much news you get, how many times you listen to a report, how many times you're on Facebook, how many times you're on YouTube listening to the various opinions of the various people. My suggestion would be to find one newscaster or one news station and stay with them and listen to that, not even that all the time.
You know, that's an interesting approach. I think that I would call that wellness. I was looking at a list I think may line up with what you're saying. It's called emotional wellness. What can you do to make sure that you're focused on emotional wellness? The brain issue or the mental issue is not going to go away because coronavirus is here. But as you said, what you can control is your emotional wellness. And I'm looking at some of the stressors, some of the things that cause you grief. Who are the people that you're worried about? You know, those kinds of things. There's some other things that you can do, like you can spend time reading, right? You can spend time looking at the things that are around you, because we don't pay attention to a lot of things that are going on in our life normally. Minus coronavirus, we pretty much go. And I'm sure a person with this brain issue is focused in their world as well. I mean, they have pretty much the same issues that we have. It's just on another level. Am I right?
Well, I think one of the things that I do want, yes, you're right. Let me answer your question.
Okay.
However, the other piece that I am committed to is to be able to say that it's impacting all of us.
Okay. Well, that's kind of what I was saying. You're right.
Yeah. And the brain is impacted in enormously different ways based on individuals. And in full disclosure, I've been dealing with depression and anxiety my entire life. I was diagnosed in my 20s, and I continue to be in therapy and in treatment, sometimes medication, sometimes not. And I'm quite open with that, mainly because I want people to begin to understand mental illness is not a death sentence. It's not even debilitating. If I don't talk about it, no one would ever think and or guess, because I manage it in a way that keeps me pretty balanced. And so with that being said, I want to begin to have people to understand that what we're experiencing in this coronavirus has never happened before. So that in itself is what I would call professionally trauma, because trauma has to do with change. And trauma is trauma. There's no way to gauge what is traumatic to one person, which may be not even registered to the other person. So when we look at all the change that this coronavirus has brought to our society, and begin to understand it from the effects that it has on our brain, I want to piggyback on what you said. We have to begin to pay attention to our surroundings. We have to begin to at least understand that we need to begin to understand how it's affecting us. And because it's affecting us in the health space, and it will begin to affect us, I think, more in the judicial space, because when this is over, the effects on it, the trauma of it is not going to end. When we talk about someone going to war, the research says it takes up to 5 to 10 years to see the adverse effect on those soldiers once they leave war. And we always talk about this. I've heard people talk about the coronavirus, as this silent killer. We're in a war, we're fighting against it. And truly we are, because even the hospital nurses and doctors and all the staff there, they talk about never witnessing death at the level in which they're witnessing it. Trauma. We're talking about people that we know 3 people away, people that we know 6 people away that are dying. And we listen to the numbers of people who are dying and or have been diagnosed with it. Trauma. We talk about kids being home from school. We talk about people working from home. That's a change. And I think the healthiest thing to do at this point is to begin this level of recognizing that what's happening is just it's nothing to be laissez-faire about. The results of this will present itself as time goes on. We don't have a blueprint. This has never happened before, so we can't say, well, the last time this is what we did. So we're making the rules as we go along, and in making the rules, we need to understand what we're dealing with. And when it comes to mental health, it has to do with the impact of this quote-unquote trauma on the brain, and understand that trauma presents itself very differently in different people. And another point I want to make is that the children, because their brains are less developed than ours, then the trauma of all this disruption in their lives has even more a devastating effect. And if we are not conscious of that, we'll miss all the signs that are going to show up if they have not started showing up already. That's in our children, and that's in ourselves. We want to begin to look at it and understand what's going on so that we can better take care of ourselves as we move through this. Because we are moving through it. All of us who are blessed enough to be alive and still be functioning at a healthy level, we're moving through it. It's just what we're doing as we're moving through it.
Well, that's interesting. So the effects of the coronavirus is particular to not only an adult versus a child, but also which community you live in, I would assume. Because the pressures that are inherent to one community is different than another. For example, for the Caucasian community, I would think that because there is this laying off of a lot of jobs are not available, a lot of people are out of work, that's stressful for them. Whereas a lot of Black people are used to not being on a job. So that may not bring as much stress to that community as it does to the other community. Am I right? There's some differences there? Or?
Oh, absolutely. And that's what we have to pay attention to, the variances in the outer community and the variances in our own community. Mm-hmm. One of the things that I think is very important is to think about the elders in our community, because the ones who had family support, they may not be able to see their families often because of this sheltering in place.
Right.
That impact will be different for our elders. And then you look at a higher economical group, their elders may be in a facility where someone is caring for them every day.
Right.
We need to be much more vigilant about making sure that those elders who may be living by themselves or living with another family member who may or may not be fully equipped to deal with them, that we are doing something for them. And that we begin to understand that even though our children may be happy to be out of school, that huge change in their life has long-lasting effects. And I'm saying this from a total professional standpoint because I understand what trauma is, because I've dealt a lot with childhood trauma, and probably 96% of my practice in working with people to help them resolve the trauma of their childhood in their original families. And we're not talking about horrendous child abuse or horrendous anything. We're just talking about the normal progression of what happens in a family that could leave one child totally traumatized, another child maybe not as traumatized. So if we begin to understand that trauma in our childhood carries itself to our adulthood, then we begin to understand that this traumatic experience that is dealing with the entire world basically has to have some long-reaching effects. And absolutely, depending upon your resources, and depending upon the availability of resources, you will be able to manage it in a certain way. And those of us who understand that we tend to not have resources that is specifically designed for what we're dealing with, we sometimes just don't deal with it. We leave it to fester, and then I also believe professionally take ourselves into the judicial system and absolutely lead to what we're now calling these underlying conditions. Mm-hmm. I'd really like to hear some research, in which we probably won't find any because we're talking about us, that talks about all these underlying medical conditions that were most probably triggered by mental stress and mental instability.
Well, we're talking to Dr. Kalina Brown. She's a licensed psychologist, and she is in Texas. She's in Texas, a little town outside of Dallas. She's a good friend, and she is sharing with her her professional opinion about how the coronavirus is affecting our community, especially and specifically our mental health community, which she likes to address as the issue with the brain. And I respect that. I think that is a good segue, transfer from something negative to something not necessarily positive, but more is kind and is gentler, if that makes any sense. Because you don't want people to feel stigmatized And so we do have a couple of questions here. One from Donna Barkley. How do you get employers to see this at a time like that? See what, Donna? Let's hear what the question is. To see what? Let us hear back. Unless you, Dr. Brown, understand what she's asking.
I can only venture a guess.
Okay.
Is she talking about having the employers understand the impact of trauma in your life at this time?
Donna,
that's a guess.
Give us a little bit more information in reference to your comment so we can address it. We'd love to do that. Again, we're talking to Kalina Brown. She's in Texas, outside of Dallas, and she's kind of just doing a respite up there. She just got back from South America, helping that country over in Ghana develop their mental health program. No corona, she says. How do you get employers to see this at this time with no corona? No corona. Okay, a little bit more information. You can type in a little bit more information so we can understand the question. We really want to have a dialogue with you.
He's saying without the coronavirus having, I'm assuming, Donna, past history, and because we're talking about mental health, that employers understand that, well, if that's close to what you're saying, then there are laws that are in place that employers, because when you have a mental health diagnosis, you fall under the Disability Act. And if you make the employer aware of your diagnosis. Like, take myself for example, because I'm diagnosed with depression. If I was employed, would fall under the Disability Act. And in the United States, there are several regulations that have to be followed as it relates to employment. Because if your depression and or anxiety or whatever your diagnosis might be, if you are having issues with it, i.e. it's not manageable and it impacts your ability to work, then yes, you are protected under that act. However, because of the stigma that we talked about earlier, a lot of people don't like disclosing it, and which even I think is less healthier. People won't go get diagnosed because, again, they think that then stigmatizes them. If I could do anything in my career, it would be to help change that. Because mental stability is what is needed for any level of success and any level of continual success. And for us not understanding that, we leave ourselves vulnerable to a lot of the negativeness that happens and the unhealthiness that happens in our lives when our brain is not functioning at its best. And I've never been ashamed of my diagnosis. Before I became a clinician in the field, I talked about it because starting therapy at 22, it helped so tremendously because of what I was going through in my life at that time, that I was so happy that I found something. And I thank God for it because I believe that it was God's grace that allowed me to be in the place at the time where I was able to get it, because my job back in 79, 80, my job sent me to see a therapist because my work performance had changed so drastically. I didn't even know I needed to go see anybody. And when I started going to see that therapist, I began to realize that those things that were happening in my life that I took as part of what happens was really mentally unstable, and I needed help. So that's what I want people to understand, because I repeat myself by saying, as we go through this coronavirus, it's impacting us in so many ways that it is going to change the way we are functioning. And if we don't understand it, we're going to miss it. And we're going to think it's something that it's not. And we're not going to get the help that we need. And even in that sense, as a community, I think we need to begin to advocate for more mental health support. And it'll keep us out of jail, and it'll keep us employed, and it will keep our children healthier because their parents are now healthier.
Awesome. You touched on a lot of things there, and I'm going to have to take some notes because I want to come back to a couple of those things that you mentioned. But I want to go back to Donna, and then we have another question from Ms. O'Ree Bailey. Donna says, okay, with the coronavirus going on, how employers don't care. They say just use FNL as family something, I'm sure, or flexible something. I'm not sure what the FML is. Are you familiar with that?
I am.
Okay, what is that?
It's the Family Leave Act, to be basic. If you have someone in your family that is ill, you take care of them, you can use that as leave, or I think you can use it for pregnancy for the husband.
Okay.
You don't have the leave already.
Okay, so right now you can't use it for brain therapy.
Well, you don't have to have that, because again, if you have a legal and recorded mental health diagnosis, then you fall under the Disability Act, and they have provisions by which you can be out of work for that reason. Just to give you an example, I had a professor at Spelman, a PhD in psychology, and she was diagnosed with anxiety. And one of the things that was happening was that she was newly diagnosed, and when she and I were working together, it became apparent that she was not stable enough to work, because she was dealing with the pressures of people finding out, which we talked about. She was dealing with the pressures of her family, and she was dealing with the fact that she could not herself believe. And I'll be even more transparent. She was the one that said to me, "Can we call it a brain disease?" So that's where I get that from. 10 years ago when I was working with her, and I was like, "Why is that?" She said, "Because I'm having a hard time thinking of myself as mentally ill." Because I have a PhD in psychology, so in her world, that didn't fit.
Right.
She said, "It's better for me if I think that my brain is sick." And so that's where I got that from, and I've been using it ever since, because, as you said, it feels kinder to people. So in her case, I gave her the documentation that was needed from the college, and I signed it, and she was out of work for 30 days.
Okay.
Yes. And so there's nothing the employer can do if you bona fide have that diagnosis and your clinician says that you need whatever time off. So, yeah, Donna, and without that, yes, you'd have to go under that family leave ordinance, and I'm not sure of all the requirements for that, but I know it has something to do with someone in your family being ill, a child or a spouse or a parent, because it's not you being ill and taking sick leave, it's you taking sick leave to care for someone else. And it's a relatively new regulation, though it's kind of familiar to most people. I'm thinking 5-10 years maybe.
Okay. Well, I think that Donna Barkley got most of her answer. If she didn't get all of it, we're going to go back to Miss Ojali R. Ori Bailey. This may be someone you know. I think that she may have mentioned your name earlier. She said, "Can you speak about our children and how to ensure their mental health is intact after experiencing coronavirus?"
Okay. I think the thing that I said earlier was for parents to become aware of the fact that they are being adversely affected. And as different as the child's personality, each parent would have to begin to pay more attention, because if a child is sleeping more than usual, if a child seems less interested in things that they were interested in, if a child is eating more, if a child is eating less, if a child seems to, we call it, lose the luster for life, let's call it being bored, and I don't have nothing to do. So if you're hearing more of that than usual, then you begin to understand something is happening. And so the impact is going to be there. So once parents are beginning to realize that there is a difference in their personality and their behavior, is to start having conversations with them about what they're thinking, what they're feeling. I'm a huge supporter of directness when it comes to children. I think as early as 2, 3, 4, you could talk with them at their level. You know, we always talk about becoming physically that child's size. So you go down to them and you meet them at their eye level, and you begin to listen to what they're saying. And parents really, and I support parents, and I thank God I don't have little children, because parents really now need to go into their children's lives and create situations for them to express themselves, create situations for them to continue learning. I know they get this computer lesson or what have you, though children, I don't care what a lot of people say, have really not changed since the beginning of time. They like moving, they like doing, they like being involved. And parents tend to give them a device. And right now, the device has some need, i.e. the schoolwork, though parents really need to begin to understand their children at their individual developmental stage and create situations that will support healthiness. Talk with them, share information with them, help them to understand that they're safe, and that to the best of the parents' ability, they will keep them safe. Don't make promises you can't keep, but say to my best of my abilities, I'm going to make sure you're safe. And if you have any questions, ask me, and I'm going to do my best to answer. Because when children feel as if they can come to their parents, guess what? They'll come to their parents.
Well, and I think that's lifelong too. I have a son who has his own son, but he still, communicates with me and talks with me. May not come out and, ask a question, but he will share so that I can give him some input. So it continues on. I can be a witness for that. Do you have some ideas, some techniques that you want to share with our viewers in reference to some of the things that they can do? I know that I have a niece in Tennessee, where I thought you were. She's in Nashville, and she is a single mom with a son. And of course, they're both at home. And I see on Facebook where she's having him study the world via a globe, do some science projects to kind of talk about discovering different things in that part of the world. Just a lot of activity, even exercising on TV with the exercise trainers and so on. So, I think that's seems to be a stimulus for a child too.
Yes, definitely. I think one of the important things when I work with families, one of the most important things that I share with them is to give the child the lead.
The lead.
Yes, because oftentimes parents don't think of children as having a mind of their own, a thought of their own, and they absolutely live in a world of their own. And so parents tend to go into their children's lives and take over, tell them what to do, when to do it, how to do it, and you better have fun while you're doing it. So if you were, especially in these times, if you were to be able to understand that with or without you, your kids have a world. They do. They're alive. So if you really want to engage them and keep them engaged, give them the lead. Go into their world and say, what do you want to do today? And let me say this to parents. If your child says, I don't know, that is a sign that something unhealthy is happening. One or two things, because they do know, because they don't not know. And one or two things that's happening is that they're disengaged, that they don't really feel like being bothered to think. So, and parents allow children to say, I don't know, to so much. And then parents get confused when they're not performing academically. Because when you allow them to say, I don't know about something about them, then it shuts off their thinking. When my kids were being parented, they were not allowed to say, I don't know ever about what the question was about them. They were allowed to say, Mommy, give me some time to think about it. Let me come back to you on this. I don't know is not an answer. So when we are creating these creative things for our children to do, give them the ability to tell you. And when they're not able to come up with it, begin to understand the possibilities of why that is. You ask a child, what do you like doing? What subject do you like? Even with exercising, do you like? I'm not saying exercising is not good. I work out 7 days a week. However, a kid might not like to exercise. So if you decide as a parent that they like exercise and they go exercise, then what are you really doing? Now, if you believe the child should exercise and the child doesn't like exercising, then it's up to you as a parent to find a creative way to have that child buy in. You gotta be smarter than the kids. You gotta be smarter than them. So you find a way for them to buy in. Think how powerful you feel when you believe that you're making decisions in your life.
That's interesting. One of the things I'm hearing from parents about their children dealing with this coronavirus season that we in is that children adapt. Have you heard that? I mean, children seem to they don't, as long as their world is the same, nothing basically changes. I mean, they know that they don't have to go to school and they're happy about that and they're at home and, especially in churches, some of the pastors I've talked to have said that children adapt, so we're not worried about the children. Is that a good approach?
I would say Absolutely not. What children tend to do is stay out of the way. If children stay out of the way is because they're frightened. Yes, children are, as I said earlier, more adversely affected by this level of change in their lives because their brains are less developed than ours. We're all going to be affected. I can't say that enough. However, for someone to think a child's okay with this, they don't understand child development, brain development, personality development at all. At all. Because a 2-year-old is affected by change. When I worked in the early development sector, one of the things that we focused on was to help children, what we call transition. We had an 8-week-old room. The kids were from 8 weeks old up to 3. Then we had a 3-year-old room, and we had a 4-year-old room. And we did all this developmental stuff. It's called Whiteford Child Development Center. I was the family resource coordinator for them back in the late 90s. And I wanted to work with them because I wanted to really understand child development. And it was a 10-year project, and I worked with them for a few of those 10 years. And one of the things we focused on was when it was time for that transition, like the 2-year-old to the 3-year-old room, we started a month before. We would take the 2-year-old, bring them to the 3-year-old room, let them touch, feel. Then we do the 3-year-old to the 4-year-old rooms, touch, see, smell, feel. Then we take the 4-year-old across the street to the elementary school because they were going to kindergarten, touch, smell, and feel. Because we would practice with them change. So that is one of the most difficult things to grow in a healthy way. And we can look at that in adults who have a hard time managing change in their lives. Let's jump a quantum leap. Domestic violence, the lack of the ability to manage change. I want a divorce. No, you can't leave, so I'm going to kill you. The inability to manage change. It grows up in you, either at a healthy level or a very unhealthy level. Can't get around.
Wow, that's very, very interesting. The whole aspect of change, because we're all being affected by coronavirus, and what comes with that is change.
Everything changes.
Everything has changed.
Everything has changed.
Yeah. Yes. So for those brain cases out there, those challenged people in the brain area.
Can we normalize that some and say we all of our brains are being affected? However, they're being affected differently based on where we are in the world.
Well, we can do
separate the people. We are all being affected.
Okay. Well, all of us are not having to go to clinicians or practitioners for mental brain adjustments or counseling. We do? Yep. Am I in one now?
This is how I talk about it. I think everyone should go to see a mental health clinician, and I honestly do professionally. In the same way, I think everybody should go see a dentist.
Oh, okay.
And I've met people who've never gone to mental health therapy, and I've met people who've never gone to see a dentist.
Okay. Well, let's see if we can go down a little further then. If we were talking about funding from the federal government for hospitals and for programming, to serve that particular part of the community. If I was in that, if I was the recipient of that service, I would have to meet a certain criteria. So I'm talking about those who fit in that slot.
And that goes back again to understanding what that looks like.
Okay.
Yeah.
So what does that look like?
Well, let me see the easiest way. You could have a diagnosis of depression, and you may not need medication.
Okay.
And your depression could be managed by talk therapy. Your depression could be managed by yoga. Depends upon where you are in the disease. And I don't think that everyone who came to see me did not meet criteria for a diagnosis. However, they had enough going on in their lives that professional support became necessary. There's something else in the community. People tell me a lot of times, call yourself a life coach. People like that better. It's the same thing. The biggest difference between a life coach and me is that I'm clinically licensed.
Okay.
And if I had to choose who I would let be my life coach, it would be someone who has a clinical understanding of brain functioning, child development, personality development. I'd like for you to know that, so that when you're putting together my life actions, you're taking in account all of that.
That makes sense.
Yes. And so that's the biggest difference. And the people who met criteria for a diagnosis, I gave them one. And the ones who needed medication, I sent them to a psychiatrist for medication. The ones who had issues with substance abuse, I sent them to a substance abuse therapist, because I don't do substance abuse with an active addict. You go to the person that works with active addicts, come to me, and I'll deal with the other behavior issues that you're dealing with. And once you're clean, you keep going to that person and you keep coming to me. You see, because all these things are happening in life. When I work with couples, most of the couples I work with didn't meet criteria for a diagnosis. Their marriage did. They married a whole bunch of work.
Oh my goodness. Well, listen, Dr. Kaleena Brown has been our guest today. And of course, we have been informed all the way around that we all need therapy. We all fall into the same category of need. And so we shouldn't separate ourselves. We should all be one community, understanding that we're all going through and we're all being affected by this coronavirus.
Yeah.
Not just ourselves, but also our children. I hope that our listeners heard that so that they can spend, perhaps make some changes if needed in their own situation at home. I hope you got something out of our conversation today. I want to again recognize Dr. Kaleena Brown. She's sitting up in Dallas today, getting ready to go on another meeting later on today. I was able to get some of her time, and I pray that you were blessed. And for those of you all who may have a need to speak to someone in the Atlanta area, I'm going to put on the screen a lady's name, someone that has been recommended by Kaleena Brown that may be able to help you and your family meet to whatever needs that you have. We have a few more minutes. If you want to send your question in, you can do that. We've got about 2 or 3 minutes. But in the meantime, I'm going to ask Dr. Brown to give us her closing statement. And if you're ready, we're ready to turn that over to you.
Okay, I would close by saying in Guyana, South America, I am considered a doctor, a psychologist. In the U.S., I am an LPC. Just want to clarify that so if someone tries to send me to jail for misrepresenting myself. So let's clear that up. And that being said, I want to encourage everyone that is listening or that will be listening to do some introspective work, understand how important you are, and be able to know where you can go to get the support that you need in order to have a healthy brain. Brain functioning controls every aspect of the human existence. Brain functioning controls every aspect of the human functioning. And if you want to have a healthy brain, there are professionals that will help you create, design techniques by which to improve your brain functioning. We go to therapy, mental health therapy, behavioral health therapy, to learn how to do life in a healthy way. That's all. Thank you so much. Bye-bye.
I want to thank you again, Kalina Brown, Dr. Brown, in some areas of the world. I want to thank you for being with us. And if you just hold on a minute, we're going to go ahead and close out our show for today here at From the Top From the Top show with Emmett McCord. I hope that you've enjoyed the program today. We'll be back next Saturday at 1 o'clock. Again, for those viewers who are watching, and it's 2 weeks, a year, 1 month from now, please give us your comments. We'd like to hear from you. If you have an idea for another show, please let me know. Also, if you're interested in being on this show, I'd like to hear from you. If you want to be on From the Top with Emmett McCord, we'd like to hear from you. All right, God bless you, and have a great weekend.